Hi, how are you?
I'm good.
Good. So, I know that we want to check out our left ankle today, is that correct?
That's correct.
Okay, so to start, we're going to do a active range of motion test, and to do that I'm going to use this device, the goniometer.
Okay.
So, can I first ask you to bend this leg, have your foot flat. Next, I'm going to have you lift this leg just a little bit so I can put a towel underneath. And then if I could roll up your pant leg a little bit.
Yep.
Okay, thank you. Alright, so the active range of motion test, just go ahead, just relax for me, is going to be pulling your toes towards your shin, just like that.
Okay.
Good. Relax. So I'm going to set the axis of the goniometer in line, but distal to the lateral malleolus. Then I'm going to line up the stationary arm with your fibular head. And then if you could please go ahead, pull your toes towards your shin. Very good. And I'm lining up the moving arm with the lateral midline of your fifth metatarsal, so the outside of the pinky toe. Good, you can relax. And our reading is at 0 degrees. So based on this measurement, you can lift this leg. We are going to do a manual muscle test of the tibialis anterior. So if you don't mind sitting up nice and slow, swing your legs around so your legs are off the table. Just remove that. So for this test, we are testing the strength of your tibialis anterior. So what we're going to do is pull our toes towards our shin. So relax for me. So we're going to do it just like this. Good, relax. Now I'm going to see if you can do that all by yourself. Go ahead, pull your toes towards your shin. Good, relax. Now we're going to do that one more time. So pull your toes towards your shin. And now I'm going to try to push down. Don't let me break. Good. And since I was not able to push you down, that was a 5 out of 5.
Yay.
Hi, how are you today?
I'm good.
So, that's it. I know we're having some issues with our knees, so we're going to look at your left knee. So what I want to do first is check out your active range of motion for knee extension. And when I say knee extension, think about kicking your leg out. That's the knee extension of the knee. Does that make sense? Sound good?
Yes.
Go ahead, lay down for me. And then you're going to bend this leg, have this foot flat. And then if you don't mind lifting this leg up, I'm going to just have a foam roller underneath to support. Are you comfortable so far?
Yes.
Good. All right, to measure your knee extension, I'm going to use this tool. It's a goniometer. And then as we're doing this measurement, I'm just going to walk you through where I'm placing the goniometer at. So I'm going to find the fibular head, and then the lateral epicondyle of the femur. I'm going to place the axis of the goniometer on the lateral epicondyle. I'm going to find the greater trochanter, line up our stationary arm there. And then our moving arm, I'm going to line up with the lateral malleolus of the ankle. Alright, can you squeeze this muscle for me? Squeeze, squeeze, squeeze. One more big squeeze for me. Good. And relax. And with that, we have a 2 degrees of hyperextension for our knee extension. Right? So I'm going to move this forward. With those measurements, I would like to test the strength of your quads. So if you don't mind sitting up for me and swing your legs over to the side. So we're gonna measure the strength of this muscle right here on the left side, right? So this is a manual muscle test. So what I'm gonna have you do is you're going to lift this leg up, bring it back down. Awesome. Can you do that all by yourself? Pick up to my hand, bring it back down. Good. All right. So now, can you kick it back up for me? Now I'm gonna push down. I want you to resist. Okay. 3, 2, 1, go. And good. Relax. Awesome. Very strong. That was a 5 out of 5 on the manual muscle test for knee extension, testing the strength of both quadriceps. Hi, how are you today?
I'm good.
So, I know we want to check out our hip today, so we're going to do an active range of motion test for hip abduction. What I mean by hip abduction is moving your leg off to the side. Does that make sense?
Yep.
Okay. So we're going to use a goniometer to measure that. Alright, so what I'm first going to do is find your ASIS, the front part of your hip bones. We're going to place the axis of the goniometer on the side of the hip that we're testing, so the ipsilateral side. Stationary arms going to go to the contralateral side. And then if you don't mind holding this steady for me, so I'm going to put your hands here and here. Right. Now I'm going to line up my moving arm, the midline of the femur. Okay. Right. Relax this leg. We're going to bring it off to the side. And what I want you to do is keep your low back and your hips, pelvis, as still as possible. Okay? So go ahead and relax. Out, out, out. And relax for me. You can go ahead and let go of the goniometer. And we have a 65 degrees for our measurement. So from here, with that measurement, I also want to test the manual muscle test. I want to do that for our glute med and our glute in. Would you mind laying on your left side for me? Thank you. And then you can relax your head, relax your arms where you're most comfortable. We're going to bend this bottom leg. Good. And then I'm going to roll this hip forward. Good work. So what we're testing is the strength of your glute med and your glute min. So relax this leg for me. We're going to bring this leg up and back. Good. Can you do the same movement without my help? Good work. All right. So now I'm going to put you back into that same spot. Can you hold it steady? Good. All right. I'm now going to press down, jolt, and I want you to resist me pushing down. Okay. 3, 2, 1, go. Okay. So I would put that at a 4 out of 5 on the manual muscle test. All right, because I was able to